What if the earliest signs of dementia appeared decades before you ever expected? Many believe this condition only affects the elderly, but groundbreaking research tells a different story. Brain changes linked to dementia can begin as early as your 30s or 40s, long before noticeable symptoms emerge. That means the choices you make today can shape your brain health for years to come. Dementia is a growing global crisis, already impacting over 70 million people, with cases projected to double in the coming decades. Yet, the biggest danger isn't just the disease itself, it's that most people fail to recognize the warning signs until it's too late. By the time dementia is diagnosed, much of the damage has already been done. But there's hope. Research shows that early intervention and lifestyle changes can slow cognitive decline, preserving memory and mental clarity. The key is knowing what to look for and taking action before it's too late. Have you ever struggled with sudden memory lapses, difficulty concentrating, or unexplained mood swings? These could be more than just occasional forgetfulness, they might be early indicators of cognitive decline. The earlier you identify these red flags, the better your chances of maintaining a sharp and healthy mind. Stay with me until the end, because this information could change the course of your brain health. Dementia isn't just forgetfulness, it's a progressive condition that slowly erodes memory, reasoning, and personality. It's not a single disease but a term that covers several brain disorders that impair thinking and independence. Unlike normal aging, where occasional forgetfulness is common, dementia causes brain cells to die at an accelerated rate, leading to a relentless decline in cognitive function. The result? Confusion, personality changes, and difficulty performing even the simplest tasks. Many people assume dementia is an inevitable part of aging, but that's a dangerous myth. Science has proven that individuals can live into their 90s and even past 100 with sharp, fully functional minds, if they take the right steps. Understanding the early signs of dementia is crucial, because the sooner it's detected, the greater the opportunity to slow its progression and preserve brain function. Now, let's break down the different types of dementia. Alzheimer's disease, responsible for 60 to 70% of cases, is caused by a buildup of abnormal proteins that disrupt brain function, leading to memory loss and confusion. Vascular dementia, making up about 20% of cases, occurs when reduced blood flow damages brain cells, often following strokes or circulation issues. Lewy body dementia, which affected actor Robin Williams, accounts for about 10% of cases and can cause hallucinations, movement difficulties, and sleep disturbances. Frontotemporal dementia, Pick's disease, known for its impact on actor Bruce Willis, is less common but progresses rapidly, often causing drastic personality and behavioral changes at a younger age. So how do you know if you or someone you love is at risk? What are the 6 warning signs that could indicate the onset of dementia? Let's dive in and uncover the key signals your brain might be sending you. First early sign, struggling with language. A subtle yet significant early sign of dementia is difficulty recalling words during conversations. You may notice someone hesitating mid-sentence, using vague descriptions instead of specific terms, or replacing words with similar but incorrect ones, like calling a jacket a blouse. Over time, they might start avoiding discussions altogether to hide their struggles. This condition, known as aphasia, was one of the first symptoms seen in actor Bruce Willis before his diagnosis. It doesn't just affect everyday speech, it can also make it harder to remember names, even of close friends and family. These language difficulties occur because dementia gradually damages the brain regions responsible for word retrieval and verbal expression, particularly in the left temporal and frontal lobes. While dementia cannot be fully reversed, early intervention with speech therapy, cognitive exercises, and social engagement can help slow progression and improve communication. If someone frequently loses track of conversations or struggles to find the right words, don't ignore it. Early action can make a meaningful difference. Second sign, apathy and loss of interest. One of the earliest and most overlooked signs of dementia is apathy, or in medical terms, anhedonia, a loss of motivation and interest in activities that once brought joy. If someone who used to love dancing, shopping, or socializing suddenly stops engaging, preferring to stay isolated or inactive, it may be more than just a mood change. They may begin avoiding family gatherings, withdrawing from conversations, or abandoning hobbies they once enjoyed. While conditions like depression and anxiety can also cause apathy, there is a key difference. In dementia, apathy is often not accompanied by feelings of sadness. Instead, it occurs due to progressive neuron loss and disruptions in neurotransmitters that regulate emotions and motivation, particularly dopamine and serotonin. Studies suggest that apathy in dementia can appear years before memory loss, making it an important but often missed red flag. Third sign, sleep disturbances. Changes in sleep patterns can be an early warning sign of dementia, often appearing years before memory problems become noticeable. These disruptions can take many forms, including excessive daytime sleepiness, where someone who never used to nap suddenly feels the need to sleep in the afternoon. On the other hand, some people experience insomnia, fragmented sleep, or frequent awakenings throughout the night, leading to chronic fatigue and mental fog during the day. Another red flag is vivid dreams, nightmares, or restless sleep behaviors. Some individuals may experience restless sleep syndrome, where they move excessively, kick, punch, talk, or even scream in their sleep without realizing it. Research has linked these disturbances, especially REM sleep behavior disorder, RBD, to a higher risk of developing neurodegenerative diseases like dementia and Parkinson's. But here's something even more concerning. Poor sleep isn't just a symptom, it may also be a contributing factor to dementia. Studies show that during deep sleep, the brain clears out toxic proteins like beta amyloid, which are associated with Alzheimer's disease. When sleep is disrupted, these harmful substances accumulate, increasing the risk of cognitive decline. Fourth sign, declining muscle strength. Dementia isn't just a disease of the mind, it can also affect physical strength and muscle function. Research shows that Alzheimer's disease is significantly more common in women, with nearly 2/3 of cases occurring in females. While this was once attributed to women living longer, recent findings suggest that biological and hormonal factors may also play a role, as men are now catching up in life expectancy, yet the gender gap in Alzheimer's persists. A recent Australian study of over 1,000 women, average age 75, found that those with weaker hand grip strength were twice as likely to develop dementia later in life. Frailty and loss of muscle mass have been linked to a higher risk of cognitive decline, possibly because they indicate reduced nervous system efficiency and lower physical resilience, both of which are critical for brain health. Strength training and regular physical activity may help counteract this risk. Studies suggest that resistance exercises, even in older adults, improve not just muscle function but also cognitive performance by increasing blood flow to the brain and reducing inflammation. Fifth sign, changes in sensory perception. Dementia doesn't just affect memory, it can also impact the senses, often in ways that go unnoticed by family members. One of the earliest signs is difficulty with depth perception and spatial awareness, making everyday tasks like judging distances, stepping off curbs, or reaching for objects more challenging. Some people also experience a diminished sense of smell and taste, which can affect appetite and food preferences. Another key change is increased sensitivity to noise. Sounds that once seemed normal, background chatter, music, or crowded places like supermarkets, can feel overwhelming and distressing. Additionally, hearing loss is now recognized as one of the biggest modifiable risk factors for dementia. A study published in The Lancet found that untreated hearing loss in middle age significantly increases dementia risk, likely because the brain has to work harder to process unclear sounds, leading to cognitive strain. Sixth sign, Postural change is one of the lesser-known early signs of dementia is subtle changes in posture and movement. These shifts are often mistaken for normal aging or mild muscle weakness, making them easy to overlook. A person may start walking with shorter, slower steps or dragging their feet instead of lifting them properly. Their balance and coordination may also decline, making tasks like holding a cup steady or using utensils more challenging. Another key sign is a gradual change in posture. Some individuals begin hunching forward or leaning slightly to one side without realizing it. Research suggests that these changes may be linked to declining brain function in areas controlling movement, similar to what happens in Parkinson's disease. Since these signs often appear subtly, they can go unnoticed unless you know what to look for. Paying attention to these early clues can help detect dementia sooner, allowing for better management of symptoms and improved quality of life. Now that you're familiar with the early warning signs, let's dive deeper into the more specific and advanced symptoms of dementia. 10th symptom: short-term memory problems. Memory loss in dementia isn't just about forgetting where the keys are, it follows a distinct pattern. Short-term memory declines first, while long-term memories often remain intact. A person may vividly recall events from decades ago, like stories from World War II, yet struggle to remember what they ate for breakfast or what they were about to do just moments ago. Beyond daily forgetfulness, they may also struggle with abstract thinking, making it harder to understand concepts like numbers, time, or financial matters. Handling money, following a budget, or even reading a clock can become confusing. This happens because dementia gradually affects the brain's ability to process and retain new information, making everyday tasks increasingly difficult. 9th symptom: difficulty following conversations. What begins as forgetting words can eventually lead to losing track of entire conversations. Someone with dementia may start repeating themselves without realizing it, struggle to keep up with a discussion, or suddenly lose their train of thought mid-sentence. They may also interrupt frequently because they've forgotten what was just said and feel the need to fill in the gaps. Complex conversations, like following a movie plot or keeping up with a group discussion, become frustrating. You may notice them nodding along without fully understanding or avoiding social interactions altogether. As dementia progresses, language processing slows down, making it harder for them to comprehend not just words but also tone, sarcasm, or implied meaning in conversations. 8th symptom: mood and behavior changes. Dementia can fundamentally change a person's personality and emotional responses. Someone who was once kind and patient may become easily irritated, while a naturally cheerful person might suddenly seem withdrawn, anxious, or depressed. These changes aren't just mood swings, they reflect the deterioration of brain regions responsible for emotional regulation and impulse control. Additionally, some individuals develop impulsive or erratic behaviors, acting without thinking, saying inappropriate things, or reacting aggressively to minor frustrations. Heightened suspicion is another key shift. They may start believing people are stealing from them, misplacing items and blaming others, or feeling paranoid about unfamiliar faces. As dementia affects different areas of the brain, emotional responses become unpredictable. One moment, they may be fearful or anxious; the next, they might be overly trusting or unaware of potential dangers. These emotional shifts can be distressing for both the individual and their loved ones, making it crucial to approach these changes with patience and understanding while seeking medical guidance for better management. 7th symptom: difficulty making decisions. Dementia impairs judgment and problem-solving abilities, making even simple choices overwhelming. A person may struggle with everyday decisions, like what to wear based on the weather, how much money to tip, or whether they've locked the door. Poor judgment can also lead to risky behaviors, for example, falling for scams, impulsively giving away money, or making unsafe purchases. As the condition progresses, they may wander away from home without notice, get lost in familiar areas, or forget to turn off appliances like the stove. These lapses occur because dementia weakens the brain's ability to assess risks, recognize consequences, and recall previous experiences, making personal safety a growing concern. Sixth symptom, loss of sense of time. A person with dementia may struggle to track time, leading to confusion about the time of day, the season, or even the year. They might forget important events, miss scheduled appointments, or repeatedly ask what day it is. This disorientation can also make them believe something happened recently when it occurred years ago. Losing a sense of time affects daily routines. They might wake up in the middle of the night thinking it's morning or prepare dinner right after breakfast. Over time, they may also confuse past and present, mistaking their grown children for younger versions of themselves or recalling deceased loved ones as if they were still alive. Fifth symptom, repeating the same questions. One of the most noticeable signs of dementia is asking the same question over and over, even after receiving a clear answer. This happens because the brain struggles to retain new information, making it feel as though they are hearing it for the first time each time they ask. Beyond questions, they may repeat stories, forget conversations that just happened, or misplace objects and ask where they are repeatedly. This repetitive behavior is not just frustrating for caregivers, it's a sign of how dementia affects the brain's short-term memory and ability to process recent events. While gentle reminders can sometimes help, patience and reassurance are key in managing these moments. First symptom, urinary or fecal incontinence. As dementia progresses, a person may lose awareness of their body's natural signals, making it harder to recognize when they need to use the bathroom. They might forget to go, struggle to locate the restroom, or be unable to reach it in time, leading to episodes of urinary or fecal incontinence. Dementia gradually weakens the brain's ability to regulate bladder and bowel control, while also affecting muscle coordination and mobility. In some cases, medications used to manage dementia symptoms may also contribute to increased urgency or difficulty holding urine. Over time, incontinence can become a daily challenge, requiring caregivers to step in for assistance. Establishing a routine bathroom schedule, using visual reminders, and choosing easy-to-remove clothing can help manage the condition while maintaining the person's dignity and comfort. Dementia isn't just genetic. Lifestyle, diet, and environment play a major role in whether we develop it. Head trauma, strokes, chronic infections like HIV, and circulatory issues such as atherosclerosis and atrial fibrillation can increase risk. Poor nutrition, excessive alcohol, smoking, and deficiencies in B1 and B12 are also key contributors. A study found that over 60% of stroke survivors experienced cognitive decline within a year, highlighting the link between vascular health and brain function. Can dementia be prevented? Yes, to some extent. A Finnish study on 1,200 older adults found that lifestyle interventions, nutrition, physical activity, and cognitive training helped maintain brain function. Build cognitive reserve. Lifelong learning, playing an instrument, or speaking a foreign language strengthens brain connections, delaying cognitive decline. A study on American nuns found that some had Alzheimer's pathology in their brains but no symptoms, thanks to their mentally active lives. Exercise regularly. Physical activity increases BDNF, a protein that supports neuron growth, and reduces dementia risk. Both aerobic and resistance training, like weightlifting, benefit the brain. Quit smoking. Smoking damages blood vessels, increasing the risk of strokes and neurodegeneration. Stopping early can significantly lower dementia risk. Control blood pressure and cholesterol. Hypertension and atherosclerosis are major risk factors, and studies show statins reduce dementia risk by 15%. Maintain a healthy weight. Visceral fat triggers inflammation and raises the risk of dementia, as well as sleep apnea, which worsens brain function over time. Manage blood sugar levels. Alzheimer's is sometimes called type 3 diabetes. Insulin resistance starves neurons of energy, accelerating memory loss. Studies suggest that insulin nasal sprays improved cognitive function in Alzheimer's patients. Prioritize sleep. Deep sleep helps the brain clear beta amyloid and tau proteins, which are linked to dementia. Research shows that people who sleep less than 7 hours per night accumulate more of these harmful proteins. Improve your diet. The MIND diet, combining the Mediterranean and DASH diets, has been shown to slow cognitive decline, while the ketogenic diet shows promise in improving memory and cognition in early-stage Alzheimer's. Excitingly, after 20 years of little progress, 2 breakthrough drugs, lecanemab and donanemab, are offering new hope. These immunotherapies help clear toxic beta amyloid proteins, slowing cognitive decline. Although these treatments are currently expensive, they represent a significant breakthrough, offering hope for the future of dementia care. As research advances, accessibility and effectiveness are expected to improve. While dementia is complex, many of its risk factors are within our control, and the choices we make today can shape our cognitive health in the years ahead. Adopting brain-healthy habits early can make all the difference. If this information was valuable to you, share this video to spread awareness and help others take proactive steps. Don't forget to subscribe for more insights on protecting your brain and overall health. See you in the next video.